On this segment of the program, we're looking at effective oral hygiene practices for a lifetime of healthy smiles. Why are we doing that? We're seeing people that are coming down with lots of issues that relates to oral care and teeth, to be very, very precise. We've heard people using all sorts of things. But this morning, my guest, who's a consultant of several years standing, will be letting us in on how we can care for our teeth and, by extension, our mouth too. Dr. Babalola Castano is a consultant family dentistry with General Hospital Ifako-Ijaiye, and is right here with me. Dr. Castano, nice having you back.
Mr. Victor Cherry.
Good morning.
Thank you for having me here.
It's been a long time we had you on this frequency. What's going on?
Well, it depends on when you call me in.
Busy, right? All right. So we're here talking and smiling to ourselves. And one of the things that really, really depicts a good smile is the teeth. Is that correct?
Well, you're very right. Without the teeth, you can't smile. You become ugly overnight, immediately.
So talk to me. So how would you assess Nigerians and the way we care for our teeth?
First and foremost, let me first say that the mouth is the expression of somebody's personality. Just like no country will ever leave their border unguarded. Many people, many negotiations are leaving their mouths unguarded. They are leaving their mouth unkept, uncared for. And the mouth is a gateway to the body. Whatever you allow through your mouth will surely modify and influence your lifestyle. So it is a very, very important. Negotiation must understand that oral hygiene, oral care is most important. It's not only when you have toothache,
right?
You have whether you have ulcer in the mouth or sore in the mouth. You must make a regular habit of seeing your dentist at least minimum twice a year. All
right, we'll talk about when we should see our dentist. But Dr. Castano, if you say we do not really cater for our mouth, a lot of us wake up in the morning, we brush. Is that not sufficient? Are you saying that's not sufficient for us to care for our mouth?
That's not sufficient. Just like saying, when you talk about cleaning, somebody can come around and clean some places and it's still very dirty. There are techniques of cleaning the teeth, cleaning the mouth.
Okay.
Many people just take their brush, just brush anyhow, brush horizontally. Under 1 minute, it's just spit out the toothpaste and they feel they have washed. It shouldn't be. When you take your brush in the morning, you brush your upper teeth down and your lower teeth up. You brush the surface of your tongue. You open your mouth wide. You brush the inside of the upper teeth down. Then the inside of the lower teeth, you brush it up. You do that for between 3 to 5 minutes. Taking good care being meticulous, clean the recesses around your cheek.
Right.
By so doing, the teeth should be clean.
So how many times am I supposed to brush in a day?
Minimum, you have to do it twice daily.
Twice?
In the morning and the last thing at night.
Before you go to bed?
Before you go to bed.
So if I do it only once, I am not doing the right thing?
You're not doing the right thing because you are allowing food to accumulate around your teeth and start giving us gum disease or tooth decay.
Yeah, but Dr. Castano, we don't have the time. I don't have the time.
You must create time. You must create time and form an habit with it. Many people, it's not that they don't really have the body, they have not really inculcated into their daily routine.
Okay.
Some people will even remember, I need to do my brushing now. I'm almost on the bed. I'll do that tomorrow. Let's make it an habit. Because when you do something for 30 solid days, it becomes part and parcel of you.
Right.
Be intentional in doing that.
So what are some of the common illnesses that could affect the teeth? All we're used to is, let's just use the teeth to eat. We eat and eat. But we're not cautious of the kind of illnesses or perhaps diseases that could affect the teeth. So what are they?
The commonest is the dental caries, what generally is known as the cavity. That's the commonest disease in the whole world. Next to it is what we call gingivitis. Gingivitis is what progresses to periodontitis. And what do I mean?
Talk to me.
Bleeding gum.
Bleeding gum?
Bleeding gum.
Wow.
So when you are brushing and you see blood stain, there is a problem. There's fire on the mountain.
Okay. So gingivitis, that's one. And then
periodontitis.
Yes, that's another.
The first one is dental caries, cavity.
So what are some of those myths? Because a lot of times when we do certain things, some of them are termed as misconceptions, right?
Yes, sir.
So a lot of people have misconceptions in this part of the world about our teeth and how we should really, really care for it. For you consultants, you come across people on a daily basis. What are some of those common myths that you hear?
Like some people will tell you, like grand ceramic plate to be washing. Some will tell you I use charcoal. You see, those one are abrasives. Definitely inside the toothpaste there is abrasive. There's no doubt about it. But toothpaste does not only contain abrasive. There are other things like fluoride. And the fluoride is to make the teeth resistant to tooth decay. So if you use abrasive only, as in charcoal, broken and ceramic, grounded ceramic plates and what have you, you'll be abrading your teeth. You are not introducing something that will make the teeth resistant to tooth decay.
Okay.
So this is one of the misconception. Some people will tell you I use early morning urine. Some people will tell you I use bitter leaf stick to brush. Those ones are wrong. If you can use your chewing stick.
Okay.
If you use those one, but the proper usage is what is most important. There is a proper usage of all those things. Those things are not bad in itself. Bakwayo is also good for some systemic disease, like it helps some patients with sickle cell anemia. However, the usage, brushing, you haven't chewed the chewing stick very well. You now take it to brush your upper teeth down vertically. Vertically. Then horizontal and the lower teeth up vertically. All this horizontal brushing technique is totally wrong because it's going to give you what we call gingiva or gum recession. The gum will be long, be receding, going down, and the teeth will seem as if it's getting longer.
Right.
And if that persists, the teeth will become mobile because the supporting structure of the teeth will have been lost. It will be getting dissolved as you apply too much pressure, because once you keep applying pressure in a particular point, it gets atrophied. The bone just starts dissolving, and when the bone continues to dissolve, what happens? The teeth become shaking. And as it has been said, if these foundations are being destroyed, what shall the righteous do?
That's very true. So, but when we talk about oral hygiene, it's not just about the teeth, right?
Yes, sir.
What else are we referring to there?
Oral hygiene also involves the gums, I have said. It involves the gum. Like the first thing, if you notice bleeding gum when you are brushing, what you need to do first and foremost is teaspoon level of salt, a glass of warm water. You dissolve the salt in there and you gargle with it. Do not drink, gargle with it. What does that do? That gives it's an osmotic effect. You understand? Then also it's also bacteriostatic, that is, it kills germs. So if you do that like 2 cups in the morning, 2 in the afternoon, 2 just for about a week, the bleeding gum should stop. If it doesn't stop, you need to see your dentist. Very important.
All right. Lagos Traffic Radio 96.1 FM. This morning we're looking at perhaps the best practices. We're looking at effective oral hygiene practices for a lifetime of healthy smiles. And taking us to the classroom is Dr. Babalola Castano, who is a consultant family dentistry with the General Hospital Ifako-Ijaiye. Very, very shortly, I'll allow you to join the conversation as well, and then we can take that to the next level. If you want to ask any questions that relates to your teeth and oral hygiene, you can feel free to do that on the program as well. All right, so when we talk about the tongue, for instance, sometimes when people get close to you, they speak and they have very, very bad breath. Dr. Castano, what could be responsible?
As I said earlier that your mouth is the expression of your personality. A lot of people take so much time in using cologne, using deodorant, perfume, and what have you. But go near them, their mouth is dirty. Their mouth, they have odor. As I've said, when you brush, the way I've talked about, upper teeth, you brought it vertically down, lower teeth, brought it vertically up. You will remove all the debris that can lead to odor in the mouth. But also, like you rightly said, the tongue also harbors all this debris. That's why you have to clean your tongue every time you do your toothbrushing. Because inside the tongue is not smooth. It has papillae. And with the papillae, there are crevices inside the papillae. That's the way, because they secrete some hormones and all of you.
All right.
An enzyme inside the papillae. There are also taste bud and also all those things inside the papillae. So the food tend to hide under inside the papillae. So when you do your brush, you gently, not rigorously, just gently brush your teeth from the back outward. Gently roll it out, and you rinse. And when you do that every day, the papillae gets cleaned and whatever, and you are just good to go.
All right, then. Lagos Traffic Radio 96.1 FM 080-99120777 and 09153877127. Those are the numbers that you can connect with us if you want to ask the doctor any question on the program this morning. Feel free to do so. What are the most effective techniques for brush? Anyway, you've talked a bit about that, how we can brush, right? You said we should brush from up down, right?
Yes, sir.
Down up.
And also the surfaces of the teeth itself, because food tend to pack inside it. I mean, on the surface of the teeth. So you brush the surface of the teeth, the upper and the lower. You brush very, very, very well, but not using maximum force. You know, some people brush as if they are fighting their teeth, or there's something. I must scrub it, just gently. And that's one of the reasons you have to use medium strength. To brush. Soft brush.
What about the brush itself? Does it matter? Because we have some brushes that are very, very hard.
It matters a lot. Some people used to. I would not recommend. Those days we encourage smokers brush. Add brush.
Okay, there's a smoker's brush.
They call it smoker brush. That's very hard. The bristle is very, very hard. That is not advisable. Because why? No matter how you're going to use it, you are going to end up abrading your teeth and destroying your gum. And before you know that, if you look at the edge of the gum, you see some cavitation there. It means you're already destroying the teeth.
All right. Okay, so when the teeth falls off, can it be replaced?
Abundantly. We have a three method of replacing the teeth. The first one is we have the denture. You can replace with teeth fall off. You can use the denture. You can use a ceramic bridge. You can use a ceramic bridge. We can use an implant. So the best technique is an implant.
Okay, implant, right?
Yes, sir.
All right, Lagos Traffic Radio. Some questions coming in. This one says, "Good morning. What's the best type of toothbrush to use, manual or electric?" Mrs. Johnson, do you have electric brushes now?
Yeah, there are electric brushes, but personally I would subscribe more to manual, because electric brushes rolls. At its rolls, the application, people will not get the application properly. As in taking a manual toothbrush, a medium strength bristle toothbrush with a pea size. Don't go and take all the toothpaste in your tube and just put it on the brush.
Just small.
Brush it. Just pea size, granule size toothpaste. Roll it first around your teeth with your mouth closed. Then you now start doing up and down brushing technique. The brush the up teeth down, the lower teeth up. Open your mouth again, brush the lower teeth up.
Let's take this call, and then we'll get back to that. Hello there.
Hello, good evening. Good morning.
Good morning. What's your name?
My name is Bumi. I'm calling from Ogudu.
All right, Bumi from Ogudu. Go ahead.
Okay, I just want to ask, what causes tooth discoloration even after regular brushing?
Thank you very much. Let me just say for the first principle. We have two sets of teeth, the milk teeth and the permanent teeth. The milk teeth are for the children. The children's teeth are whiter. Why are they whiter? They have little dentin. So they are whiter. Adult teeth is browner.
Okay.
So because you have more thicker dentin. Now, when you talk about tooth discoloration as it were, we can have exogenous and endogenous tooth discoloration.
Meaning?
Exogenous means something you acquire.
Okay.
As you are taking, like the Britons that like taking coffee, there can be tooth discoloration as a result of the coffee sedimenting on the teeth over time. Okay. Then also, if during pregnancy, mother takes tetracycline, some drug like tetracycline, mother has eye fever, or the child immediately after birth has eye fever, or the child take tetracycline, it can cause intrinsic discoloration.
Of the teeth.
In which case, the discoloration is actually incorporated in the substance of the teeth. So there's nothing the dentist can do about it. We only tell you, we have enamel apoplasia. There are some other genetic diseases like dentinogenesis imperfecta, amyloidosis imperfecta that lead to teeth discoloration. So we have a myriad of them. But definitely, there are also different shades of teeth. Even though the adult teeth tend to be darker than children's teeth, there are different shades based on how the nature just created.
All right, just a question here. It says, good morning. I brush my teeth every day, but my mouth still smells in the morning. Why? You didn't put your name, but thank you so much.
Let me just
Does that happen?
Yeah, it may happen. It depends on what time of the day. You understand? Even when you brush it at night and you go to bed, you sleep, You know, in the saliva, there is an enzyme. We call it taline. Enzymes are protein. Protein naturally smells.
Wow.
The same way beans will smell. You know, it will just smell. Now, if you have stagnation of your saliva for a long period of time, even though you have brushed your teeth, if you are opening your mouth for the first time after a long stagnation of saliva in your mouth is bound to smell, because that's why if you see the front desk officer, they will tell them you must chew your gum. Why? Because they want continuous flow of saliva that will keep washing, rinsing the mouth, the oral cavity, so that there is no stagnation that will lead to odor being generated.
All right. So there's so many questions that are popping in here for you. By the way, if you want to join the conversation this morning, feel free. 091 5387 7127. That's 091 5387 7127. This one says, good morning, Lagos Traffic Radio. For those with mouth odor, how do we help them? Sheon from Ikeja. The same Sheon is still asking, says, good morning, Lagos Traffic Radio. What is your take on those that do teeth whitening? Can that last and also give lasting white teeth for good breath? Sheon, thank you so much.
Okay, let me take your
first and second question.
The second is the whitening.
Yes.
Now, personally, I have reservation about teeth whitening.
Why?
Exactly. It's like bleaching your skin. When you bleach your skin, when you're a dark person, you bleach your skin. Definitely there will be relapse. That's one. And not only you are bleaching, you are eroding the skin. The same way, when you bleach your teeth, you are washing the surface, the enamel off, because you are using some agents that will wash it off. So I will tell you, when you do your whitening, you are going to have relapse one.
Okay.
Because that's not it will get whiter, but that's not the real color that the nature has put there. So it will relapse. Not only that, you do it so often and vigorously, you have sensitivity. Strong shocking feeling, because we are washing the surface, the substance of the teeth off. However, for those that I know, most of the time I normally subscribe for them to have bleach and teeth bleaching, and those who have exogenous skin stains, those who have been taking so much of tobacco, so much of coffee, so much of cola nut, who have brownie stain that is acquired, not inside the teeth. Okay. So when you bleach those one off, the color of the teeth normally comes around again. But if you don't have all those stains and you're just bleaching, want to make it will get whiter, yeah, no doubt. But you remember you are washing the surface of the teeth off, and it's not in your best interest.
Which is not very, very good. Like Dr. Castano says. Another one here says, good morning, Victor and Dr. Babalola. Please, is mouthwash essential or just a fancy extra? Deborah is sending this one from Molly.
It's just optional. It's very
Deborah,
optional.
thank you so much.
It's very, although it can help, but it's optional.
Okay, let's take this call.
Okay.
Let's take this call. Hello there.
Hello, Mr. Victor. Good morning.
Hey, good morning.
Yeah, this is Dr. Busari.
Yeah, Dr. Busari, nice having you
yes.
on the program.
Good morning, Dr. Kasali.
How are you doing, Dr. Busari?
Fine, yes. My question is treatment of tooth disease is becoming so expensive. My son who is a postgraduate student in UI, just 2 weeks ago, removed one of his teeth. And he told me he spent 96,000.
He spent
in UID.
96,000?
I'm telling you. Then again, I sent money for his drugs. Now, 2 days ago, he told me that 2 of his teeth, he needs to remove them and needs to refill one. I don't know how much he's going to tell me again. No.
Yes. I hope he's not scanning you.
No. He showed me after doing it, he scanned something I saw at the University of Ibadan. He showed me everything. He showed it to me.
Wow.
Sir,
why is it becoming so expensive? Or it's not like that in Lagos State?
Okay. It depends on the teeth that is being
extracted.
That's more. First and foremost, we should realize that virtually all our consumables are imported.
Okay. So it's making things very difficult now, very expensive.
Is a strong factor. Yeah. If we have an entrepreneur in Nigeria or industrialists that can go into manufacturing of this dental material, it should make the treatment become cheaper. Okay. Then also, there are different kinds of extraction that we have. I will not lie to you. I have had to extract a teeth. In fact, that was about 2 days ago. And the patient has to pay 100,000 naira.
Wow. Why?
The patient asks, doctor, you understand what I'm saying? He has osteomyelitis, and the last tooth is impacted in the inferior border of the
Let's see if we can
mandible.
let's squeeze this call in before we begin to wrap up. Hello there. All right. I guess we lost that.
All
Go
right.
ahead.
So I have to do sequestrectomy as well as remove the third molar at the lowermost portion of the mandible.
So can we have complications like that? Do we have
There can be complication, but thank God it's properly done and the patient is doing fine. When I reviewed the patient, that was yesterday.
Wow.
So a patient paid 100,000 naira.
So it could
What
be
do you
as
think about it?
expensive as that.
It depends on the procedure and what you're doing. Then you're having a third molar that is lying totally inside the bone and is disturbing the patient. The cost will surely be more.
What causes
because that's surgery?
What causes those kind of malgrowth? If I'm going to put it that way, I mean a growth that is not normal in the teeth.
We call it a dental-alveolar disproportion.
Okay.
What does that mean? It means that some people have small jaw and big size teeth. So, and as the teeth is growing, there is no space for them to come in.
Wow.
So, dental-alveolar disproportion.
All right. Let's quickly take in some of these questions before we wrap up. This one says, can bad teeth be inherited from parents? You didn't put your name, but thank you so much.
Bad teeth, not really.
Not really?
Not really.
Okay.
Not really. I don't think so.
All right. This one says, good morning, TGIF. My gums bleed when I brush. Is that a sign of something serious?
That's a sign of something that is beginning to get serious.
Okay.
So she needs to come to dental clinic in Leh, and of a general hospital where there's dental clinic for checkup.
Right. If there is manifestation of cancer in the body, can it reflect in the oral health?
Definitely. Yeah, cancer in the body. Like some people have esophageal cancer. I mean, cancer of the esophagus. And what do you see? The first sign may be bad odor.
Okay.
Some people have cancer of the lungs, bad odor. Just like, why is this person having bad breath?
Right.
And you look at the mouth, everywhere is clean. You look at the teeth, there's no cavity, but it's just coming out from the esophagus or from the trachea. Do
you have a call? Okay. Let's see. All right. So let's begin to wrap this up now, Dr. Castano. So you work with General Hospital Ifako-Ijaiye, right?
Yes, sir.
So for those who have teeth problems, you guys have a space there where people can really attend to any of the illnesses that affect their oral health?
Definitely, abundantly.
Okay. Does that include replacement of jaws?
No. We have not gone to oral surgery. We have not started oral surgery in Ifako-Ijaiye General Hospital.
Okay.
But all the other minor surgeries can be taken care of.
Can be done there.
Facial, we have not gone to that.
Right. You did say people should visit the dentist how many times?
Twice a year.
Twice in a year. One should come around. The least that one can do is what? Scaling and polishing?
Scaling and polishing. Provided your teeth, you have no cavity, you have no other ailment, but at least it says some people would remove all the dirt that have accumulated in your mouth over the years.
Okay, then. So some of us can go for the World Smiling Championship by the time we're done with all of this, right? Dr. Castano, it's always a thing of joy to have you in the studios.
Yeah,
what's your parting thought to our listeners this morning, quickly?
Legosha, I really seek your indulgence to know that your mouth is an expression of your personality and you need to take it more seriously. Thank you very much.
All right, then. So he is Dr. Castano, Babalola Castano. He's been around for quite a while. He's a consultant in this regard, and I can tell you, he's one that can take us to the classroom anytime, any day when you call upon him, even at very, very short notice. So this morning we've reflected on effective practices, effective oral hygiene practices for a lifetime of healthy smiles. Dr. Babalola Castano is consultant family dentistry with the General Hospital in Ifako-Ijaiye. We have to go. The program has been produced by Dayo Anthony, Mary Olufolahon in the building, Victoria Vincent also in the building as well. And I say a big thank you to Okpayemi Shodunke, who is of our social media unit. Our executive producer is Tayo Akonle. My name is Victor Terry. I'll be back shortly for The Benchmark.